Sunshine meeting to discuss the City of Miami's efforts to address homelessness. We are here now in City Hall. We have access to the public both on Zoom and TV and call-in and people here in public. I am your chairman, acting chairman for the moment, Commissioner Ken Russell. We also have Jeffrey Watson on the dais, and Commissioner Reyes will be joining in a few minutes. This is a very delicate and incredibly important subject in a moment when the world of technology is looking at Miami to invest in our city. You know, it's really important to remember what our true job is here, and the judge or the measure of any great city is how they take care of their least fortunate and how they provide quality of life for all of their residents. And so I think this is a perfect time to bring up this subject, and especially with a new commissioner on the dais, Commissioner Watson, who's asked and called for this meeting to introduce all of the stakeholders and give you all time to address us as well with some of your recommendations, requests, and suggestions. And of course, to hear from the administration what their current post-Pottinger world of dealing with homelessness in the city of Miami looks like from a outreach perspective, a services perspective, a policing perspective. All these things are very important. And of course, all of the organizations that work with the city and the county, you are our partners. And we need to continue investing in you, and I think it's really good to know what you do and to put that on the record. So let's have a great discussion this morning. Commissioner Reyes is joining. You're very welcome, sir. And I'm going to actually hand it over to Commissioner Watson, who called this meeting to guide us in this discussion. Good morning, sir.
Good morning. This meeting was called in part because of an issue that we were asked to address a meeting ago, and clearly because of the number of people that are in the core area of either downtown or District 5 and my colleague to the right. And so I think that for all practical purposes, we're always looked upon, but we share only part of the responsibility of dealing with this issue. The other components of it are shared by other entities. And my biggest fear is that we are not capable of handling it by ourselves, and therefore we need to talk more to each other so that there is a coordinated effort. We spend a lot of money, and a lot of money has been spent, and when you spend a lot of money, you usually wonder, why don't you see something different? And so from that perspective, we had an issue of some funding that came down from Washington that really had some stipulations beyond what we do, but we accepted it because we have the problem, only to move on to a organization that deals with the problem. And I think that we were not completely, I say that, maybe we were not completely informed in what was necessary aside from the money, and a lot of consternation came about because we only focused on the money. And so it made sense to have the administration come forward and all of the stakeholders in this issue come forward so that we can do something better than what we're doing and therefore hopefully get a different outcome. Because it's not just about arresting people, it's really about some other things that people have. And so our police force is taxed. Our administration is taxed, and not taxed in your tax way, but taxed in having to do more than our fair share. And so we're trying to understand so that we can make better decisions on how we can all do better, because we're sitting up in here and at some point life may change and we might be homeless as opposed to just dealing with the homelessness. So that's why I asked for this session so that we can really help make better decisions and as we look for a different outcome and not respond to some occurrence, but really do something that's ongoing and sustainable so that we can see a different outcome. That's it.
Thank you. Commissioner Reyes, do you have anything to open us with that you'd like to bring up during this, this Sunshine meeting?
Well, I'm real glad that we are having this conversation because it is needed. I have seen, I don't know if I'm right or it is that, I don't know, they are more visible now, but I have seen an increase not only in downtown Miami, but in my neighborhood, in Calle Ocho on Flagler Street. I have seen an increase of homeless, of people that they are sleeping in bus benches, just by the bus stop, you know, using as a refuge, those benches that they are on the cover. Oh, and also in downtown Miami, I have seen also an increase in the number of homeless. Also, one thing that I want to point out is that, and I guess that everybody that goes around downtown Miami will be able to witness also. Last Friday, you see, I have this habit of going around driving my district, and also since now I'm the sheriff of DDA, I drive in downtown Miami and I drive around. You see, at night and sometimes during the day to see how it's doing, how the illumination coming along, et cetera, et cetera. And I'm driving around downtown Miami, and I'm going to be precise. I'm going to give you a specific place on Miami Avenue. It was next to Flagler. There was a person that it didn't look like a homeless, although he was only in shorts and had some flip-flops and a T-shirt. And I was walking on the sidewalk, and there was this person that obviously was a homeless. And this individual, he went to, it was a place that on the sidewalk, he knelt, he bent over, he got a little package. I don't know what he got. And there was an exchange of money and the package with the homeless. You see? I saw it. It was in plain sight. There were people walking. And if that is happening, you see, my question is, what can we do for that our police department take action? And can we have some undercovers there? Can we do, what does it take that type of activity? If it is not eliminated, it is substantially reduced, and anybody that is dealing with drugs, the last that I heard is illegal, right? Those people should be arrested. The homeless and the dealer. Both of them. You see? And that, in my opinion, that's the only way that we are going to at least, I know that being homeless, it's not a crime. We cannot be, inhumanely get them out of there. We try to help them in all the way. But there's a lot of drug addiction among them. And why don't we do something besides just trying to get them off the street, trying to either try to bring it in, or have the places that maybe they can rehab, try to get them those that want to rehab. But by all means, we have to curtail the supply of drugs. You see, we have to curtail the supply. We have to try to eliminate the supply of drugs for those people that are homeless because they are addicted. But if I saw it at plain sight, Mr. Sherman, anybody would have, anybody would have known what was going on. You see, the way that the transaction took place, and those people, they don't have no shame, because I was looking. My wife was looking. I put my windows down and I looked at it. It was like, what are you going to do to me? You see? Well, we got to do something. We got to do something. And I think that would be a great start. try to curtail the flow of drugs. You see, be as strict and as possible as we can. And and that's something that I don't know how we can do it, Mr. Chairman, but there's something that got to be done.
I think that's a very good topic to make sure is on our agenda, policing and safety, and understanding the police department's policies now with regard to crimes like that.
And I know that when you were the sheriff, the DDA sheriff, you were very concerned about that too. And I heard you. You see? I heard you, and we have to work together on this. So.
Yes, and I don't think anyone is disagreeing with you that we should, saying that we should not prosecute crime. If there is a crime being committed, absolutely we should be taking action. Absolutely. I would like to, we can start there, or we can start with our stakeholders. I think police policy is something that we as a body do not dictate. The chief of police can let us know where he is on that. But what we do control is the purse of this city and how we expend our funds with our partners in this issue. And I know there's been discussion at recent commission meetings about maybe changing how we flow that money. So maybe that's something we could talk about too.
Yes, sir. Maybe we can, some of that money could flow for police protection. Maybe we can use it. But it is important that we get the full support of our police department.
Yeah.
You see. And I bet you that same thing that happened in downtown Miami is happening in Overtown on 14th Street, on 7th Avenue.
Yeah.
The same thing is happening. You see, the same thing is happening.
Then let's start with the topic of policing. And I see some of our assistant chiefs here. And if that's all right with you, Commissioner Watson, as well, we'll address the policing issue.
Well, let me say this.
Yes.
Commissioner, let me ask for this, because I thought you were going to go that route first.
I'm open either way.
Yeah. I think, look, the police department is kind of our part and should be last.
Okay.
What I'd like to find out is how many stakeholders are here, those people who are extensions and agencies that are also service providers, and what are they doing, and whether or not they're talking to us and we're talking to them in order to be coordinated in the problem first. Look, illegalities are illegalities, and if you do illegality, then police should do what they should do. But that's not the topic, because I'm trying to kind of get off of it being the police first, because they're not first. There's an issue, and some folks ought to be doing something, even if they're coordinating with our police department, to help us resolve the problem. And then I'm right with the commissioner. The illegalities should be dealt with in a way that they're already dealing with, right? But let's find out of monies we spent with service agencies, of pass-throughs we try to go to service agencies. What are they doing? Because they got to be seeing this as we're seeing it and want to do something as we would like also to do. So that's kind of the biggest thing.
Fair enough. And as you called this meeting, I'll certainly defer to your request. I do see stakeholders here who work with us. Obviously, we work together with Camillus, with Lotus, with Chapman, with the Homeless Trust. We have some folks on Zoom. Ron Book is raising his hand. You are recognized, sir. Good morning.
Good morning, Mr. Chair and Commissioners. Thanks for the opportunity. I'm going to attempt, Mr. Chair, to walk through a bit of a presentation, because I do believe that sharing some things that you and Commissioner Reyes are more familiar with, but Commissioner Watson is less so. So in order to answer a number of the questions he's asked and address some of the questions that Commissioner Reyes has asked, I'll get to those in the tail end of trying to answer sort of the broader question of what are we doing and how are we doing it. So firstly, thank you for calling the meeting, because I do think it's important. And Commissioner Watson, we talk fairly regularly to the commission when asked and given those opportunities. Over the last 2 years, both Commissioner Russell and Commissioner Reyes have been extremely active at getting us engaged in a dialogue. But the balance of the dais has as well. Commissioner Diaz de la Portilla, Commissioner Carrillo have also expressed great concern. At a recent meeting, it's been asked what's changed with regard to homelessness. First of all, the Homeless Trust, Commissioner Watson, to you through the chair, about the time you went to Washington, the Homeless Trust was just kicking off 25, 26 years ago. We still remember well our first visits in the early days to see Secretary Cuomo in trying to get housing money out of HUD when he was secretary. Since those early days, 6 times under both Republican and Democratic administrations, the Homeless Trust Continuum, and I will add, we're a partnership, and while we look at ourselves as a public-private partnership, with Chapman being our linked partner because they helped us build and they pay us for the opportunity to manage our 2 shelters that the trust owns, the one at 15th and North Miami Avenue and the one in Homestead, and our overall continuum where we, if you will, buy services, beds, and the like from many of the other community partners, Camilla's House, Lotus House, Rescue Mission, the Salvation Army, all of whom are participants within the continuum that we oversee. And for the benefit of all of you, our budget has generally been the last several years about $66 million in the continuum, which are much of our continued recurring expenses, not just of shelter, but much of our housing as well. Nearly a year ago now, the Homeless Continuum began rapidly developing and implementing an emergency infrastructure to protect persons experiencing homelessness from COVID-19. We were listening to the CDC. We were not listening to President Trump. We were listening to Dr. Fauci, Dr. Birx. We were listening to the Florida Surgeon General. We were interfacing directly with the CDC, who came here to our community to see what we were doing differently than continuums around the country, because our numbers were defying all of the national numbers. And whether you were looking at New York or you were looking at LA, whether you were looking at Seattle or you were looking at Houston, our numbers were just dramatically better. We started on Saturday, February 22nd, to kick off our effort in downtown Miami, in the area behind Macy's. All of that DDA area, Commissioner Reyes, Commissioner, as a total look, driven by the prior chair and Commissioner Russell, the chair's direction, we've attempted to be responsive. I want you to know, since that first conversation, commissioners, about how many tests we've done, we've now administered a little over 15,250 tests. No continuum in the country has administered that many COVID tests in a homeless continuum. We partnered early on with the Division of Emergency Management in Tallahassee through Director Moskowitz to make certain that every single week, once the swab gathering kits were made available, you will remember that in those first 2 or 3 or 4 weeks, there was a national, if not an international, shortage of the swab specimen gathering kits. They had the kits, but they didn't have the swab kits that were required. Once that happened, we continued to get a regular shipment every single week, and we continued to test. You should know that of those 15,000 plus tests that have been administered, we've had fewer than 225 positive cases since we started testing in March. Our positivity rate has defied not only the county and the state positivity rate average, we have been below 2%, most of the time hovering around 1.2%. The DDA, by the way, commissioners, the DDA in those early weeks were our source for sanitizing bottles. We didn't have enough of them. We had sanitizing wipes. We turned to the DDA to help us. We went to the streets in 3 languages, English, Spanish, and Creole, trying to teach those chronics on our streets, reminding them what proper sanitization and personal hygiene was about. In those early days, we were begging for masks, and we were begging for gowns, and we were begging for sanitizing wipes and bottles of sanitizing solution because we didn't yet have that full flow. And the downtown community responded. We've stood up 5 quarantine and isolation sites in the county. We've assisted more than 3,400 individuals. We vaccinated now over 200 elderly individuals and staff over 65, including sheltered and unsheltered individuals. We're just getting started in the vaccination world. We've prioritized people at highest risk for severe illness, for permanent housing, with more than 515 active referrals. We have been actively involved in getting people off the streets. Commissioner Reyes, to you directly, I share your frustration at the visibility. You will recall a couple of times during COVID when I've had the opportunity to address you as a commission, my discussion about the tents. We begged some well-intended individuals in March, April, and May to stop handing out tents. It was not a good thing. It wasn't a productive thing. Once the tents got there, the CDC guideline of disrupting encampments, as you know, we have attempted on a number of occasions to get them socially distanced, to get them out of the tents into our hotel placements. And while we've been successful in many instances, we've been unsuccessful in bringing down the visibility of homeless that are highly more visible today because of those tents. We've been proactive in marketing our homeless prevention resources. We've mailed to more than 7,400 individuals who have been the subject of active evictions that were filed prior to the moratoriums going into effect. We've sent one to every residential household in Miami-Dade that we believe, based on our analysis of zip codes from the cases, working with the clerk of the courts and 5 or 6 judges to identify where we believe the problems exist. And let me make a point to you that ought to be a concern of all 2.7 million people that live in our village. Of those cases filed, we believe that it represents close to 23,000 individual lives of family members in those 7,400 plus eviction actions. We believe that close to 1/3 of those people are elderly. And if we rolled the clock back to 2008, 2009, during the great economic recessionary period of our lifetimes, regulations were put into place, and most of the large multifamily rental buildings in our communities now, in order to rent, an individual has to meet a minimum credit score. If eviction actions get eviction orders signed, their credit rating will go in the garbage can. If you're an elderly person, you will never be able to rent again. We will have sentenced those people, after having survived COVID, to a life of either living with a relative, living in a shelter, living in a car, or on the streets. And I don't know about your loved ones, but I know that if my mother and my father were still alive, they wouldn't survive a day on the streets. These are not people that have ever experienced homelessness before. We've activated 6 times now since December cold weather emergencies. And in just the past 2 days alone, we've moved over 100 people into quarantine and isolation. Why? A, we've got the 5 hotels still open. B, we will not move people into shelter today that have not been quarantined for the minimum of 10 days now, demonstrating that they don't have COVID. And number 3, frankly, our shelters are packed because all of them have moved to social distancing type sleeping arrangements in the sleeping dorms. And so we've moved them to hotel placements. Our outreach teams, and let me, as always, without the green shirts that the city of Miami provides, without those 21 outreach teams, without the leadership of Sergio and Lazaro helping us get to where we are today, which if you think about it, in the 25 plus years, we've reduced street homelessness by 90+% and been able to maintain that because of the outreach teams from the city of Miami. They work without a lot of fanfare and a lot of recognition. The outreach teams, the 286 individuals that work at Chapman, that work at the Trust directly, that work at Camillus, that work at Lotus, that work at Rescue Mission, that work at the Salvation Army, those 286 people have risked their lives and their families' lives for almost a year now, putting the lives of homeless individuals, the least fortunate of our communities, ahead of their own health.
Thank you, Mr.
Many times, the outreach teams, as well as the staff of those facilities, have had to quarantine because of having been exposed themselves. We conducted our census on February 21st, our annual point-in-time survey that many of you will remember. HUD requires us to count once a year. We count twice a year. You're supposed to count all homeless continuums nationwide during the last 10 days of January. As a result of COVID, there was some flexibility as to when you counted. We counted February 21st. Unsheltered homelessness in Miami-Dade County is down 13%. Homelessness in the city of Miami is down 15%. Total unsheltered homeless in a county with more than 2.7 million people is 892. And since 2014, we have not seen numbers that low. We've seen reductions in downtown South. And if you go behind Macy's, to use Macy's as the example, dramatically reduced. Bayfront Park, dramatically reduced, as well as in Little Havana. We've seen increases in Allapattah. We've seen increases in Wynwood. But overall, the total number is down. And while unsheltered numbers are down, encampments, and specifically to Commissioner Reyes's point, it's not just that encampments are up and more visible, but substance abuse, in our opinion, and our folks are out there every day, is up in a meaningful and significant way. And I'll come back and talk some about the law enforcement piece, because I don't believe we can arrest our way out of homelessness.
Mr. Book, I'd like to focus, though, on the services and the share of responsibility between the city.
I'm sorry.
And so, yeah, I know there's so much to cover, and there's so much to cover, and you do so much. So my question would be, and just a minute, Commissioner Reyes, my question would be, do you believe there's anything that should change within the share of responsibility from a financial, policy, programmatic perspective between the city and the trust?
Look, I personally, Mr. Chair, I believe that the working relationship that we have with your City of Miami team is better than it has ever been. I think our communication, whether we're talking about the manager's office and Mr. Vickers, or we're talking about outreach, or we're talking about the police department, I think our communication with the DDA and our relationship with the DDA is dramatically better than it's ever been. I think that when we're pointed to areas, we attempt to focus targeted resources in the city of Miami. Could we always use more resources? Sure. This week we're issuing an RFA seeking $4.1 million in new federal funding from the state for specialized street outreach with emergency shelter targeting persons with alcohol and substance abuse dependence, including those in those encampments. We can't be successful, Mr. Chair, without the involvement of the city and without those outreach teams helping us. The rental assistance with services to get people already experiencing homelessness permanently housed is critical. We just launched a joint effort with the Miami Foundation to secure new facilities to expand our permanent housing capacity with primary focus on senior citizens and unsheltered single adults, which are in the city of Miami urban core. We've identified properties outside of the boundaries, outside of the geographic boundaries of the city of Miami for that permanent housing. One is down south, far south and west, and the other is far north. Far north. Both focused on the problems in your geographic boundaries. Elderly, single males. We are not unmindful of the continued issues related to predators and offenders, and we are targeting the population to provide some additional, if you will, focus in the boundaries of the city there as well. We are looking at other creative ways through working with Thriving Mind, the Project Lazarus program of medicating hard to serve unsheltered individuals on their streets continues to be a priority, continues to have those resources focused in the city of Miami, and we have committed to your police department that we will provide a shelter bed to any homeless person waiting treatment as part of a new grant targeting opioid users. Again, coordination with the city has never been better. We've set aside shelter beds for targeted outreach activities led by the City of Miami homeless outreach teams, and we've provided guidance to the city on best practices to serve those unique needs of those in encampments that the CDC continually tells us we cannot tear down. If we get somebody in the encampment with a tent to come inside, we can pull their tent down. And by the way, there is no social distancing in those encampments. Those tents are side by side in complete violation of every social distancing rule that we know of.
Thank you, Ron.
Mr. Booth,
So, yes,
Yes,
Go ahead.
Commissioner Reyes had a comment, and then Commissioner Watson.
Yeah, Commissioner, my question is very simple. As you stated, we have an increase, and I foresee an increase of people on the streets due to evictions. Unless the federal government and the state government provide funds for us to assist those persons that they have lost their jobs and they haven't been able to pay their rent or their mortgages. You see, I think that we have to be prepared for that, because it is horrible, it will be horrible to see children on the streets also. You see, we have, I don't know how we're going to do it, if we should set aside, Mr. Chair, and fellow commissioners, some of the funds to assist those persons that they have been evicted because they have lost their jobs, and assist those families, particularly families that, as you well stated, they were going to be on the streets and it's going to be a very traumatic experience for them. So I don't know what we can do, but we should be prepared. We should be ready for them. We should be ready for them. I hope that it doesn't go to the extent that I foresee, but if it does, it is our duty and as public elected officials, and I think it's not only ours, it's also the county and everybody else, to try to assist those persons, those families, and that have been evicted due to COVID-19.
Commissioner Watson?
Mr. Book, aside from that University of Florida jersey that's behind you, turning on me, oh, Lord. Quick question. The biggest component in this, unfortunately for all of us, so I'm looking at the 5 organizations you called out, there must be maybe $150 million annually put towards this issue, notwithstanding whatever we spend. There appears to be, as you say, unsheltered. Unsheltered is everyone's biggest problem. And continuing care, which is what we don't do, winds up being a problem for us. In the category of tent encampments, you beg people not to give out tents. And the visibility and physicality of it is a constant reminder that something more needs to happen. In your opinion, how do we deal with unsheltered, not coming down 15%, coming down 50%? How do we deal with the encampments or tents not being given out? Because then, unless you tell me something different, it becomes harsher because it falls on our guys in the field to do something because other people are saying you should. Help us with that.
If I could, Mr. Chair, through you to both Commissioner Reyes and Commissioner Watson's questions, because Commissioner Reyes had questions embodied with his statement. So first of all, and both responses are going to link. So first of all, on the issue of evictions, we spent the last 12 weeks getting ourselves ready for the moratorium to have expired. We expected the moratorium to have gone away before now. Thankfully, it hasn't. We spent a lot of time with the clerk of the courts, Harvey Rubin, his deputy, Mike Henderson, identifying the total number that had been filed, where they were, and then developing a plan, 3-stage plan, which was identify where and who, create an education program that includes communicating by mail, by phone, and a robust media campaign so that people know to call us, driving them to our Stop Evictions Now or the Homeless Trust regular website, knowing someone that, as Commissioner Reyes and Commissioner Watson, Mr. Chair, have spoken to, those that are about to become homeless, we don't need the individual to have to call. If someone knows someone, send them to our website. If they believe they are 6 or 8 months, 3 months, 4 months behind in rent, they know that the 3-day notice is coming or come already, that they know there's going to be an action. We need to know where they are now. There is a lot of money coming to us. We have millions of dollars of CARES Act money coming from the feds to the Department of Children and Families, coming down to us. We have emergency services grant money, ESG money. One of the items that's been deferred, your agenda is some of that money. But a lot of that ESG money has strings to it. Individual's got to be imminently in danger of homelessness, meaning inside of 21 days. Means the order's already been signed. The bulk of the money coming down now has no strings. It allows direct negotiations with landlords for the safety net to keep them from becoming homeless. Are we going to get them all? We know we're not. But once we know we've identified them, we can work further to find other opportunities to keep them from landing on the streets anywhere within our community. To the issue, Commissioner Watson, look, I think for the moment, while we have been focused on getting unsheltered into our hotels, and I think when you look at the census numbers and how we got down to that 892, look where my isolation and quarantine people are. The goal was to get them there, have case management and services available so that they never go back to the streets, so that we get them permanently housed. If we divert our attention for the moment, Commissioner Watson, to the balance of unsheltered that have yet to come in, and we take our eye off the ball over here on the evictions, we're going to end up with a massive problem. We know that the bulk of those 892 are chronics. On the streets for 365 or more consecutive days, had 4 instances of homelessness in the last 3 years. Those individuals are shelter resistant. It's about housing them. We have a lack of available housing in this community. You know that, I know that. The entire commission knows that. It's the worst rental housing market probably in America today. If we do not find money to acquire buildings, which we have not historically looked to do, we have looked to the private sector to help develop, if you will, affordable housing for the extremely low income population, which is where affordable housing originally started. Didn't start by talking about workforce 20 some odd years ago. It was about those other populations of low wage earners. But we know we have elderly people that have been in shelter for 900 to 14 and 1,500 days that we've got to permanently house. If we don't find this capital money, I don't know how we get below the number we're at today. We know our resources are largely depleted. While in a year or so, we'll get some reimbursements from the federal government through FEMA. We don't have a lot of that today to go buy property. And we have to buy buildings that are existing. The 2 that we've identified that will take several hundred people off the streets immediately are part of that equation. So the answer to your question is, we reduce it while we're over here focused on evictions by acquiring these 2 properties, renovating one that needs some renovation, and it dramatically reduces the balance of the unsheltered.
Thank you
I
very
don't
much.
know if that fully answers both questions, but I've tried.
Understood. You're recognized. Thank you.
We're here because we have a big problem in our hands, and we want to use city funds as effective as possible. And that is the question that every one of us have here. And also, as we were saying that you were addressing, and everybody is aware of, it is a potential of having more people on the streets due to evictions. It occurs to me that we should take preventive actions before it happens. Is there a way that we can identify those people within the city of Miami that have been, that their evictions are almost imminent, or they are that they are in court now because of the moratorium. As soon as the moratorium it's over, those people are going to be kicked out. So we can start helping them and trying to accommodate them someplace before we have to take them off the street. You see, take preventive action, be proactive, and not wait until they are on the streets in order for us to act. I don't know, Mr. Chair, if that could be possible, and we can use our departments. You see, for example, we can use Vickers' department and in conjunction with everybody else and anybody, with the courts, whatever, and then try to identify those people that are close to eviction, and maybe we can use our funds, and your funds, sorry, in order to protect them, and or take action in order to avoid seeing them on the streets.
Just a moment, Mr. Book. Mr. Vickers, if you'd like to address us, and then Mr. Book after that, how can we identify those who are at risk of eviction?
Mr. Chair, the Homeless Trust, I believe, has that list. The list was provided, or probably provided, by the clerk of the court by zip codes. We also requested that data as well from the clerk of the court a couple of weeks ago. But we now know that the Homeless Trust has it, so they can provide that information for us. The item that you had on the commission agenda, I believe a couple of weeks ago, that addressed, I think it was $5 million for rapid rehousing. I don't want to necessarily speak to that. Alfredo Duran can, but part of that funding would address individuals who have the potential of being evicted.
Meaning if we utilize that funding, or if the funding went forward as the resolution states? You're saying in the way the resolution is written currently, there is funding that would be allocated
Yes.
for rapid rehousing?
So,
Thank you.
so
That's what I
Mr. Chair,
wanted.
Mr. Chair.
Mr. Watson, then.
While we're doing that,
Yeah.
I think that's, and let me go out on a limb, we just receiving, or it's in transit, $14.1 million for evictions, right? Mr. Book just said they're getting millions of dollars for evictions. So collectively, let's look at what those stipulations are, because usually they come with a lot of strings, and get a hotline so we can get the list, and if someone is in trouble by way of that list, then they should be able to reach out, hotline us, and we help with that process, right? That's a relatively easy one, I say, but sounds like a relatively easy one, particularly if they're getting evicted. I've seen notices in handing out food cards. Can you help me with this? No one should have to jump over no hoops. It should be fairly easy. If they have a notice, and if they're on the list, let's help them out. That'll help with Commissioner Ray's issue, right?
Commissioner Watson, this goes back to what you originally asked, though, or stated. What is our responsibility, and what is our stakeholder partner responsibility? Is the hotline our hotline, or their hotline?
The hotline can be a collaborative effort for everyone that has those funds so that it can be seamless for people. And I know that they get money countywide, so I don't want to get mixed up, but we should have a hotline number so that when they call from the city, they're on the list. If they're in the city, our funds can be used for that, as well as the funds that he has, I hope he has, designated for that area can be used for that. I think that's a way to possibly do that, but I also want to say this related to that item. That item was brought to us and was not, I say publicly, properly explained. That money was not our money that we were giving to Camilla's house. That money was a pass-through that our department probably accepted because it's needed, okay? But the number was thrown out, and we immediately jumped on it, and them, because most of that money was predicated on continuum care, case management. We don't have the staff to do that, and until they get staffed up, we need to move that money on to somebody who does that and not be worried about whatever the amount was. We were not given that money. HUD sent them that money,
Yep.
and they were just sending it on to the person who could handle it because the other person was already overwhelmed, right? So I just want to make that clear.
That is clear, and I think once we have Camillus
correct.
talking here, I think we can
Yes.
clarify that. But back to your point, what would be the disadvantage of having one hotline number versus one for the city, one for the county? Because I want to make it as simple as possible for those in need.
I'll let people who deal with the hotline issue. I just think that if residents in the city can call a number, because we got, for example, our money for city residents, then it would make it easier for them. And we need to broadcast it wide so that one will not miss it or not know, because sometimes they don't know, right? I think that would be an advantage to them as opposed to having two numbers, because we're not really dealing with.
Okay, so
county.
one number might.
Yeah, one number
Mr.
works.
Mr. Book, if you could speak to those at risk of eviction, how that list works, how you qualify them, and what you think the best way is for us to utilize our funds as well as yours to address that.
Perfect. So first of all, you've got actually greater flexibility with your money than we clearly do with any of the ESG money. You've got about 14 to 15 million, I believe, in your allocation for this eviction-related issue. The county's got about 60. So there's a lot of money here to deal with the problem. I am somewhat concerned about point of contact, because what we don't want to do is have folks going there and going here when we need them here. Commissioner Reyes's point, Mr. Chair, on the issue of identifying them, we have them identified. We know where they are, at least those that are part of that 7,400 already filed eviction actions. We believe that by utilizing the zip code tracking that we've been able to pull together, we know where, to both Commissioner Watson and Commissioner Reyes's points, we know where those low-wage earner populations exist, where those extremely low-wage earner populations now exist by zip code, which makes those the more vulnerable for eviction. And those are the people we have been in communication with by mail, by phones, and those are the ones we're begging folks to let us know about through stopevictionsnow.org. It's critical to get the message out. I'd like, if I could, Mr. Chair, ask Ms. Millette if she could, if you'd allow, to go to the podium on the point of contact issue and the hotline. And I want to reiterate, just by the very nature of Mr. Vickers' ability to go to the mic and answer the question, he knows, and that should demonstrate the level of coordination and communication we are in. We may not be doing a great job, Mr. Chair, Commissioner Watson, Commissioner Reyes, of communicating that to you with reports, but we can fix that. I spend almost half my day, every day, 7 days a week, on this issue. We have tried not to divert away from work, but if we need to do a better job at letting you know weekly or every other week the progress we're making within the city and the county as a whole, we will do that. But if I could, Mr. Chair, defer to
Yes.
Ms. Millette on the point of contact.
Ms.
Thank you
Millette's
so
at the
much.
lectern now, and clearly you have a willing sponsor for an item at a coming commission meeting to address this issue from our side. So we'd love your advice on what you all are doing and what we could do.
Sure. So we have been gearing up for weeks now on prevention, homeless prevention, as well as eviction prevention. We have a homeless helpline, and for a very long time, that helpline has had a prevention option. Are you facing eviction or at risk of homelessness? That transfers over to Camillus House, gets thousands of calls every month, and Camillus House has eviction prevention specialists, and I'll let Hilda speak to that, who know of the available resources in the community, not only the resources within the confines of the trust, such as Emergency Solutions Grant, but other pools and pockets of money through the county. We've also been working with the Greater Miami Housing Alliance and Miami Homes for All, And there's a website already put together called Access Helps, and it has co-located all of the available resources in the community, including the county's emergency rental assistance program, including rental assistance programs in communities like North Miami and Miami Gardens, who receive state housing initiative program money. So there are many jurisdictions. We know where these resources are. There's also emergency food and shelter program resources that a number of nonprofits in the community have. Camillus is fully positioned to receive those calls and pipeline them out as needed. We've also established stopsevictionnow.org. It's a one-stop site. Camillus can talk to that as well. But individuals can apply and see if they meet criteria for these very special emergency solutions grant funding dollars that we're talking about today. Those are only received by entitlement jurisdictions. City of Miami, Miami-Dade County, City of Hialeah. Those are the only entitlement jurisdictions in Miami-Dade County. We also have the ability to get an allocation through the state. Those dollars require those entitlement jurisdictions to engage with the Homeless Trust. It's written in rule to determine how to best utilize those funds. We have had many conversations with your community development staff over the last few months about how to best pipeline those dollars. That $4.1 million, it was determined would be best doing homeless prevention as well as rapid rehousing. We know today there are 2,500 people sitting in shelters across this community, many of whom came from the streets of Miami, who are eligible for those dollars. Your 4.1 will always be prioritized for City of Miami residents, people who have been scooped off the street from the City of Miami, or people with zip codes within the City of Miami. So those dollars are your dollars first. If we would not, and until we have solved every City of Miami homeless case or homeless prevention case, those dollars do not go beyond the City of Miami boundaries. Those are your funds for your folks, and we have the mechanism set up to administer those funds. We also have, as has been talked about, other more flexible sources, 15 million coming to the city, 60 million going to the county. These are more flexible funds. There is a distinction between eviction prevention and homeless prevention. The ESG dollars are really only for people who are going to hit the streets or enter the homeless system. Many people, when evicted, are going to go live with a family member, stay with a friend. We're really targeting those resources. We've looked at zip codes. We look at people who have been homeless previously. We look at people who've had prior evictions. So we are really trying to target those funds to the individuals most likely to enter the homeless system versus those more flexible funds, such as funds provided earlier for the United Way, that can provide quick cash assistance, $1,000, $2,000 to keep you up to date on your rent or other needs within your household during this very difficult time. Those funds are more flexible. The county's emergency rental assistance program, much more flexible. I should also point out that this ESG money is prioritized for people who make below 30% area median income. HUD has waived that requirement so we can go up to 50% AMI, but you really must be extremely low income to qualify for these dollars. To the contrary, emergency rental assistance program funds that the county previously administered, you could be up to 80% AMI. So we're really trying to target those people who are most likely to hit the streets or enter the homeless system. Thank you.
Thank you very much.
Quick question, Commissioner. The 2,500 persons you referred to on that list, is that part of the 7,400?
So there's two numbers and two sets of populations that we look at as being homeless. People who are living on the streets or unsheltered persons. We have a cadre there of 892 people. At any given time within these isolation and quarantine sites, emergency shelters, or temporary time-limited transitional housing programs, there's another 2,500 people who are in those programs today. That's why the item that was deferred is so important. We need to get those dollars on the street now so we can help the people who are already homeless. That opens up the capacity in the shelters, in the quarantine and isolation sites, so I can go out with our leadership and place 30 people from an encampment who we can actually convince to come in. Without that capacity and flow, We're at a bottleneck.
Okay, so in this 5.1, not 4.1, that's what I'm trying to find out.
Yes.
Yes.
Does that money help you help people and increase the capacity of now serving more?
Yes.
Yes.
Okay.
This money presents a wonderful opportunity
But
to
you still
focus
didn't
on
tell me.
homelessness.
You still didn't tell me, right quick, you still didn't tell me how many of those 2,500 people on that list are identified as City of Miami folk.
So we can tell you from where they were placed. I can do the analysis of persons in shelter and what zip code they were picked up from when placed into those facilities. And I can tell you of the 892, based on the count we just did, 555 of those 892 were within the boundaries of the City of Miami.
Okay, all right.
Thank you. Commissioner Reyes?
Commissioner Watson, it will take us today, tomorrow, to get you the breakdown of the 2,500 plus that are in the sheltered population she's referring to, but we're happy to get that to you.
Thank you, Mr.
Yes.
Commissioner Reyes.
I think that's an excellent question, Commissioner, because if we are contributing those funds that we're giving you, millions of dollars, we want to know how many of those homeless that you are sheltering now came from the streets of Miami. Because the biggest burden, homeless burden, lies in the City of Miami. We have the population of homeless is totally, it's tremendously higher than any other city in the county. So we are very concerned, and as I understood when Commissioner Watson asked for this sunshine meeting, it is to determine how can we use our funds more effectively. You see, there is a reality. There is a reality, and it doesn't take a brain surgeon to know that when you walk around Miami, you see that there is a tremendous amount of homeless. Of those 800, or some that have been identified by Mr. Book, I dare to say that 90% are in the City of Miami. You see? And if we are using our funds, we want to know how they are used, and we want to determine the most effective way and what programs should be established or should be augmented, if that's the case. But there are, besides you, that I'm not saying anything bad about Camilo South, Lotus is doing a great job too. We have people like Hermanos de la Calle, that they are fantastic. They are trying to get people off the street. And my opinion is that this program should be geared towards getting people off the street. I know that is an impossible task because some people prefer that type of life. You see, some people, the people that are addicted, I think that they could be, the effort should be made to get him off the addiction and to try to reintegrate that into society. People that are mentally ill, probably we should have emphasis on trying to identify them and take them to, try to guide them into maybe a treatment or whatever it is. And those that are because of financial crisis, then we have to help them get back on their feet. But I think that we have to be totally geared to what we are going to do, because I think the objective is to get as many people off the street as we can. And I don't know about my fellow commissioners, but that's my main concern. You see, and we're spending so much money. I think that we have to do it efficiently. We have to be targeted. And how are we going to achieve that? Well, that's for the professionals, you guys, to know and to guide us. But we want to see results. I personally want to see results. You see, when you drive, and there are certain areas that they are more homeless than others. You see, you take 14th Street Northwest, 7th Avenue Northwest. and the downtown Miami, and you see, those residents, I mean, in Little Havana, those residents, that live close to those pockets of homeless, they are suffering. See, businesses cannot thrive there. Businesses cannot thrive there. And residents, they are affected. You see, and that negative effect is the one that we want to minimize, and at the same time, be human enough to try to guide those people that are in the streets now and identify what the problem is and try to help them. You see, and I don't think you help them by giving them a tent to live on the sidewalk. That's not help. You see, that's not help. You need the ones that need treatment. You help them by giving them treatment. The ones that need shelter, you have to shelter them. You see, and think always in the long run. How can we can bring these people back on the feet that they can become part of society again? And that's my philosophy, and that's why I've always been questioning what are we doing?
Yeah.
You see?
Thank
That's
you,
what
Commissioner. If we could, so I think we should move on. We've got a pretty good identification now of funding, partner, administration sees
That's
their
right.
mission. I'll be very happy to support you in a resolution that you bring to commission with regard to this issue, because I think maybe some direction will be necessary to push that collaboration. Yes, you're right.
Commissioner Rushville, if I could just make one point to answer, I don't have specific numbers today of a number of individuals in shelter who come from the city of Miami, but we have done this analysis. We know that 555 of 892 represents about 62% of people who are homeless in Miami-Dade are in the city of Miami. We know about half of that 555 is within a 30-block span of the urban core. We also did an analysis. We know that our outreach teams, who not only cover the city of Miami, but they also cover North and South Dade through a competitive process that was administered some time ago. That's in connection with another item that has been deferred. They make 84 of all homeless placements in Miami-Dade County. So Sergio and his team make 84% of all placements into shelter in Miami-Dade County. And we know that comparably, 63 to 64% of all the placements they made are from the city of Miami. So 62% of all homelessness in the city of Miami, 63 to 64% of all placements come from the city of Miami. So I think that answers your question. And Commissioner Reyes, we have a multi-pronged approach on unsheltered homelessness. There is no bigger priority for me. I work here, I've lived here, and I see it every day. It's my job. We have a menu of options, but we are never content. We are continually evolving to try to see what do we try next. We go out there with your teams with a menu of options. We partner with Thriving Mind. We have shelter beds. We have housing. We have ID assistance. We have opportunity for people to enter detox. We have opportunity for people to enter treatment. We've committed to shelter beds to your police department for opioid users. I can tell you 200 people died in Miami-Dade County on the streets last year, and 6 died COVID positive. 44 died from opioids. We have a substance abuse issue. Thus, the last tranche of ESG that we anticipate getting from the state of Florida, we're issuing an RFA, as the chairman said, to do 2 things: provide additional housing options with short to medium-term rental assistance with support services, and hire additional outreach personnel with specialty in substance abuse to target those opioid users, target the alcohol users, target the individuals who are on crack, and do it in the encampments. So that's 4.1 that we are trying to evolve, morph, and target specifically to the city.
What is being the most effective program? The one of trying to identify the drug addicts, which opioid is being a drug addict, or the ones that could identify mental illness and try to get them into treatment?
I think there's a lot of co-occurring, both substance abuse and mental health together, combined. Sometimes it's hard to tease out. I'm not a certified addiction specialist if the primary issue is the substance abuse. But I can tell you we already have, between Lazarus and our PATH, which is also run by Camillus through Thriving Mind Dollars, they are really good at targeting mental illness. The substance abusers are harder to get to because I just gave you the menu. What if they don't want anything on the menu today? We engage them again tomorrow.
Yeah.
They don't want what's on the menu. Many people just want to be left alone. They're in the throes of addiction. So we're trying to work in every way we know how to work on this population. But I do think that we need more specialized addiction services on the street, and then just look at the numbers. And it's a numbers game. We have 35 outreach workers. We have 555 unsheltered people in the city of Miami. We do have ancillary resources that I just spoke about, but the numbers, we need more individualized attention, but every time you fund additional on-the-street attention, you do want to have enough back-end shelter beds, which also need funding, and back-end short to medium-term rental assistance. So we are trying to create a system here to keep people moving off the street, make sure there's system flow, make sure that nobody's moving off the street because of a lack of a shelter bed, or nobody's moving out of a shelter because we have no more rental subsidies. These funds keep the machine working, and we can kind of adapt strategies along the way to target those populations that we see emerging.
Well, from what I understand, what I heard is that what we need is more specialized personnel in the streets.
I'm
Right.
sorry, I didn't hear you.
That more specialized personnel, like psychologists or people that could gain the trust of the individuals, and that person could guide them into treatment and all of that. And if that's the case, well, then because I think the reason we're here is that all of us are concerned in how to use our funds in the more effective way. See? And if the experts tell us we should use it this way, well, I think that we should target our funds to be used in a certain way that they are going to help diminish the population of homeless.
So we have complemented the rental assistance resources that the city management is trying to put onto the street with the specialized resources we're seeking an RFA for. I would say that we don't just need additional potentially case management or specialized services. We need more people with lived experience. We need more people who have been homeless and come out of it to talk to these individuals because, and they need to be culturally competent. And oftentimes we need people of color because we disproportionately see people of color
Yes, I know.
coming into the continuum. We know it's 17-18% of the Miami-Dade County population, yet people of color represent 57% of the homeless population. So we need more people of color with lived experience, as well as substance abuse experts, engaging individuals regularly, trying to better understand. That's not to take anything away from your teams. They do a tremendous job. They move people every day. They approach issues from different angles. They try to have motivational conversations with individuals. But we're dealing with individuals who can say no or leave me alone.
Thank you.
Thank you, ma'am.
Thank you.
All right, shall we move on?
Yes, but I want to just have now that we can talk.
Yep.
You see, we're on the sunshine. I think that we have to analyze the possibility of us using those funds with our resources. You see, the people that we have the department, right? That department that deals with homeless, and I don't know how many specialized personnel we have there that could come and be in the streets and working together hand in hand with all these organizations and try to do what we should be doing all along. It is trying to get people off the street. See, trying to help people off the street. Because I agree with that. We need people of color. and when I say people of color, I'm talking Hispanics and Afro-Americans. Because I heard that now, with this eviction process, there are some people that they're being evicted and being taken advantage because they are undocumented. You see? They don't have their legal status in the country, and the landlords are taking advantage of it because they feel that they are abandoned and they don't have any rights. They do have rights, you see, and we need to address that too. You see, we need to address that, and I don't know. I'm not an expert, but I would like to see a program that comes from us that understand what the needs are and provide us with some sort of a plan, what they're going to do, what they're going to hire, how they're going to increase the amount of professionals on the street. See?
Would you like to hear from staff at this point on what they have available?
I would like, but also, we need, as I said at the beginning, we need the assistance of our police department. The police department has to be a little bit more active, and they have to. We have to. Few months back, few months back, I asked the chief that why certain actions that are made by homeless, they are not even. I mean, they don't even tell them, no, you cannot do that. But if I do it, me being a person, I mean, a regular resident, I'll be arrested. For example, defecating in the middle of the street.
I understand, Commissioner, but I wanted to try to get to police after we've talked to
Okay,
our
let's.
stakeholders about services.
I mean, there's a lot of things that going through my head.
Yeah. No, it's a true issue, but I think just to keep
let's
the
go
meeting
step
moving.
by step.
Yeah, because clearly, look, I'm trying to keep police at the last outcome and help take it off of them. And I hope people will correct me if I'm wrong in what I say. I'd rather see us, first of all, let me say this. When you say you need more persons of color, right? I always cringe when people say that because we're all around when everybody wants something else. If you just look a little bit harder, you can find them. In saying that, Jesse Trice has probably some of the finest healthcare professionals in this town. Okay? I'd rather join with you and them and others and find money to get those additional personnel. Maybe that's the best use of our money and not the use of the police money. Maybe they don't get to the police because telling someone who may not be coherent, let me use that word, not to do something does not do anything. And so we have to recognize it's almost like talking to that wall. Don't turn blue. Well, that doesn't work. And so if we're going to now not spend their time, we should now spend it a different way. And if that's one of the things that comes out of this, let so be it, because now they can, with us collectively, get more personnel. And maybe the short term is they partner with Jesse Trice and figure out a way where they handle that, and we come to the table and use the small amount of funds we have to help them with more personnel for that population that's increasing. I think what we found thus far, and Mr. Chair, I'll let us go to the next person, that there's some things we can do if we just kind of know what it is, and that's what we're trying to figure out, what it is. And our dollars will go a lot further and will be more helpful so that we won't be spending a lot of dollars over here with our guys doing something they really shouldn't be doing, because there's a whole lot of look, there's $100 million for evictions. Let's just coordinate the numbers, get the list, be proactive, call them, where are you in the process? And then as other people, they free up, then that keeps it from over here, because we don't have enough money over there. And then it causes other problems for us. So that's the good thing about hearing these folks out.
I want to clarify one thing, Commissioner. When I said that we need the police to be a little bit more proactive, I'm referring to the drug dealing that's going on in the street. because it really impressed me a lot when I witnessed a transaction right there in the middle of the street with people going by, cars going by, and all of that. And there's a fact that there is a lot of drug addiction among some of the homeless. So we have to curtail the supply. And we cannot do it. And I agree with you, and now that you were talking, it came to my mind the idea that we are going to find money, and we are going to use those professionals or those people that are doing it. But our money should be targeted towards certain activities. Like, for example, as you said, we need more psychologists. Well, let's get those funds to hire more psychologists. We need more whatever it is, more experts in drug addiction and how. Let's do it. You see, but target on money. I think what we have been lacking, and correct me if I'm wrong in my analysis, is that we are given the money and it is spent all over the place. Now that we know, according to her, that we need some professionals on the field, you see, well, let's target the additional funds that we're given to those activities. You see, we can, for lack of a better word, earmark some of our contribution to placing more people on the street, placing more people that are professionals in whatever you consider that they should be, you see, and maybe we will get a bigger bang for our bucks.
Thank you. No, very much agreed, and I think you are both correct. I think we're not saying different things here.
No, I got that from, it came to my mind when Commissioner Watson was talking, and I thought about that. I said, okay, we have funds that we are every year we contribute. Well, let's have some regulations on those funds. Let's have some,
Thank you. So we've heard from the trust. I'd like to hear from Camilla's House at this point. They've been mentioned several times, and their item has been deferred a couple times. I will have to say that I'm going to need to step out in a few moments. I'm going to hand the gavel to Commissioner Reyes. We do not need a quorum to conduct a sunshine meeting, and we're not able to make motions or directions at any rate. So this is a discussion for later action. But you're very welcome, and if you'd be glad to introduce yourself and address any of the things we've said.
Certainly, Commissioner. Hilda Fernandez, I'm the CEO at Camilla's House. Thank you for having us here today. Commissioner, I just wanted to start, Commissioner Reyes, I wanted to start with basically telling you that Vicki has told you you already have a pot of money to be able to do that specialized outreach. There are 4 allocations of emergency solutions grant that are coming to this community, Miami-Dade County. A pot to the city of Miami for $5 million, a pot to the county for $9.7 million, a pot to Hialeah, and a pot that's coming through the state to the Homeless Trust. Those emergency solutions grant that are going to the 3 entitlement jurisdictions, city of Miami, the county, and Hialeah, are identified to be used to serve 2 things: homeless prevention for those 7,400 people who are at the lowest income level that need assistance so they do not become homeless, so we can pay their rent backwards and whatever. A portion is for that. The rest of it is for rapid rehousing, again, to serve the 2,500 people and the other 900 or so on the street that are currently homeless by moving them quickly into housing, out of shelter or off the street. Because, by the way, rapid rehousing can take people from the street directly into housing. They don't have to stop at the shelter. That's the beautiful thing about rapid rehousing, that you can take them directly from the street. So this emergency solutions grant that are going to the 3 entitlement jurisdictions right now have to be tied to the homeless system of care, and have been directed to do 2 things: prevent homelessness for the poorest people up to 50% of area median income, or if they're already homeless, move them out of homelessness, either from the street or from our shelters. 9,000 and change, 900 or so on the street, 2,500 or so in shelter. Move them out of shelter. By the way, for the 2,500 or so people in shelter, the minute you free up a bed, we can take somebody from the street into the shelter, because that's part of the process, the flow. That's very important. But what Vicki has told you is that they have made a decision, the Homeless Trust, that with their allocation, rather than limit it to homeless prevention and rapid rehousing only, they are willing to take some of their money to do specialized outreach, an eligible expense under the Emergency Solutions Grant. Now, let me speak a little bit about specialized outreach. Camillus House operates the county's 2 specialized outreach teams right now. So Commissioner Watson, our Lazarus Project team has a psychiatric nurse practitioner, a clinician, a clinical case manager, a SOAR case manager, and a peer, another formerly homeless person. This is a mobile team. They go out on the street 7 days a week, engaging the hardest to serve severely mentally ill homeless individuals, the ones that result in the most calls to our police department, because these people are so mentally ill, they're not capable of accepting services until they can get stabilized.
So
We go
you-
7 days a week, we give them their medication on the street until we can stabilize them and convince them to come in.
So are you coordinating that, and I'm interrupting you for a reason. 'Cause
I'm sorry?
I say I'm interrupting you for a reason.
Yes, sir.
Are you coordinating that effort, Lazarus, with Commander Morales?
So, and I'm gonna explain that in just a moment. We currently have on our Lazarus team a City of Miami outreach worker, because they know our outreach population on the street and the service resistant. However, in answer to your question, we believe there could be greater coordination with police. We already met with Major Frank Fernandez, who oversees the Central District, and his commanders to speak about how we can better connect our Lazarus team and our PATH team, because we have a second specialized homeless team to deal with the mentally ill that is a resource for police. So when they come across it, because let's face it, we have a great outreach program, but there's only so many of them, there's more police officers. So they may see people in areas that our outreach team may not see them. And we wanted to create a better working relationship. So we invited Major Frank Fernandez and his commanders for the Central District to Camillus. We had a great conversation. The next step of that is roll call training, where we just explain the resources that are available to these officers and how they can access them. For example, we run a 16-bed residential treatment program for adult victims of human trafficking. It does not have to go through the green shirts. If a police officer encounters a victim of human trafficking at 2 in the morning, they can actually bring that victim to Camillus House into our specialized unit. We run programs for unaccompanied homeless youth, programs that do not require necessarily having to wait for a shelter bed to open where they can directly place. So we offered to provide training at Roll Call to Central District. Tomorrow morning, we meet with Major Jesus Ibalmea from the South District and his team to discuss doing the same thing. What are the resources we have available? How do we better coordinate with police? For those resources that we can provide, if they need someone to do somebody they believe is mentally ill, do we send our PATH team out? Do we send our Lazarus team out? How do they access the city beds? The city does pay for beds. How do they better access the city beds? So we are meeting tomorrow with the South District Major and his team to talk about how to improve the coordination between police. Because at the end of the day, when we encounter a homeless person who's decompensating on the street, we want to call a police officer to assist us with that Baker Act. We may want to call them to assist us with a Marchman Act, a concept that we're just beginning to discuss with the police department. That's when you involuntarily place someone in detox. A Baker Act is because they're severely mentally ill, a danger to self or others, you put them in a crisis unit. But if they're a danger to self is because of severe addiction, if you can make the case for that, you can have them involuntarily placed in detox. We run treatment programs. Our expectation is when they leave detox, they can be referred to our treatment beds for those clients. So I wanted to just explain the concept of being able, the Homeless Trust has just issued a request for applications out of their money to be able to field additional specialized teams, but these teams focus, what we do for Lazarus, the mentally ill, a similar concept for the severe substance abusers, the ones who are chronic substance abusers. So that process just got issued, Commissioner, so I'm just saying, hey, listen, I'm sure Vicki's probably gonna kick me when I get out of here, because if she thought you were gonna give your own money to it too, she would be happy, but I just wanna explain, your ESG money has been, designed to be used for prevention and rapid rehousing. They're willing to take their allocation and divert that to the specialized outreach. It all kind of works together. I want to talk a little bit about the homeless prevention. So, Commissioner, when you came to our visit, I remember I took you into a hallway and I said, well, if people call the 1-800-HOMELESS helpline and they pick the option which is, I'm about to become homeless, that phone rings at Camilla's house. It's been ringing at Camilla's house for, I don't know, Vicki, 15, 20 years. We've been operating the homeless helpline for the Homeless Trust for I don't know how many years now. So when someone is becoming homeless and they pick that option on the homeless helpline, it diverts, we pick it up. We have helpline specialists whose job is to figure out what the situation is with this person that's about to become homeless. And, is it an issue of paying back their rent and then next month they're going to be okay? Or, even if we paid their rent backwards, next month they would be in the same situation. You know what? Then we need to move you someplace else. We have a contract with Legal Services of Greater Miami because if we have to go into court to resolve the issue, we will do that. We have monies within what we do. We don't have all the money for homeless prevention in the county, so we work with other agencies. If they're in Westchester, we're not going to make them come to us. We're going to refer them to an agency near them that could provide homeless prevention assistance. We happen to have, we know what the other providers of homeless prevention assistance are in the community. So, whether or not the city decides to contract with us for the $5 million, which is homeless prevention or rapid rehousing, the city has at its disposal the ability to provide eviction assistance for the lowest, most poorest, most vulnerable of your residents that complements the additional money that Ron talked about. Ron talked about the city receiving, I don't know if Fredo can talk about, $14 million other dollars that you can use for people that go up to 80% of median income. Those are not the clients that would be calling the homeless helpline and being helped by the Homeless Trust. They may call the homeless helpline. When we get their information, we're going to tell them, you don't qualify for us, but here is the resource of who you need to call. If they call for us from the city of Miami, we would use, if we were to fund that agency, the city of Miami funds to assist them. There is a means for us to make sure that the people who are assisted are from the appropriate jurisdiction. We've been doing this for a while. We understand the program regs and rules, so we can make that happen. That's not a problem, but a concern for us. I do want to mention, Vicki mentioned stopevictionnow.org. So when the Homeless Trust, just so that you understand, Camillus was approached by the Miami-Dade County about what they were going to do with their CARES Act 2 funding, and they contracted with us to do that. So we went ahead and we started developing the infrastructure. So when the moratorium went away and we started getting calls, we would be ready to receive calls. Vicki mentions there's, as far as they can tell, about 7,400 eviction filings that when the moratorium gets lifted would potentially move forward. So you're talking about a significant amount of residents across the county, many of which may be from the city of Miami, which are going to potentially be facing eviction in the next 90 days, once the moratorium lifts and the court starts scheduling these hearings. So, the issue is not all of them are going to qualify for the money, that small ESG pot, but if they call us, they don't qualify, we were going to refer them to the appropriate organization. If it's in the city of Miami for your eviction assistance program, for the people that have higher income, or it's the county's eviction assistance program, or it's another privately funded or other funded program, that's what we would do when we get the call to the homeless helpline.
Okay. I want you to understand, and as I said, I've been dealing with Camilla's house since Brother Paul was elected.
Oh, my goodness, yeah.
Okay. And I know that you've been doing a great job, and there is a program that you have that I'm very much interested in. It is your job training program.
Yes.
I believe that that's the right thing to do. Because it's not only that we are going to get them off drugs or that we are going to try to get them, off the street without a job. You see, your job training program, that is an incentive that is given to homeless to come and start in that program, and that will be an avenue for them to leave the streets. My question is are you up to capacity on that program, or you need more funds, or you could enhance that program?
So Commissioner, Great question. We just started our 8th cohort of our Miami-Dade, we have a partnership with Miami-Dade College for our culinary arts program. It started on Monday. It was funded sufficiently to serve, I think it's 10 individuals. Could we do more? We would love to do more. And we could do another class. It's become a little more complicated because of COVID. Before, we used to do 4 hours of classroom on site and then 4 hours in our dining hall. Now we're transporting them to the college to use their culinary arts training kitchen where their social distancing is easier to do. But those are the kinds of programs. We're trying to get a hotel maintenance program off the ground. What we do is we work to identify opportunities in the community where there in the past have been high need. We are a hospitality-based industry. That's not the case right now, clearly, where COVID's had an impact.
Yes.
But certainly, helping, and, our culinary arts program that graduates people with kitchen cook licenses, they have certifications, OSHA, they're able to get hired. 75% of them were being hired at graduation prior to COVID, because we had restaurants and hotels and everybody needing to hire that. So we started working to identify industry needs, to be able to provide training programs so that we knew that we were going to have the ability to very quickly place people into those job opportunities. Another example, again, is hotel maintenance workers. Obviously, construction trades is huge.
That's what I was
That is
gonna
huge. So we had a partnership originally with FIU.
Yeah.
We're looking to bring that partnership a little closer to home, potentially working with another local nonprofit that has its own population, its youth, that they also want to provide those opportunities to. So we're looking at bringing a similar program going to the same foundation that funded FIU to bring it and have it happen more centrally, more convenient for us and the other homeless agencies in our area. So construction trades is huge, and that is another area that we want to go back to and start creating opportunity in.
Another question. Are you funding those programs with funds from the trust or where
So,
the
the
money
mon-
comes from?
Great question. So Miami-Dade College Culinary Arts Partnership was funded through the first 6 cohorts by CareerSource, which is the Workforce Development Board. Cohort number 7 and now number 8 have been funded by the SEOPW CRA, because it draws from individuals that are coming from the CRA district. FIU was originally funded through a foundation grant, the Construction Trades Program, and the Hotel Maintenance Program we were looking at one point of trying to get SEOPW CRA funds that have already been earmarked for job readiness programs in partnership with Miami-Dade. So what Miami-Dade did was submit this program as one of the programs to be funded by the CRA through their job readiness.
I'm just going to ask Vicky a question. Could you partner with them, and try to expand those programs? Because I think they're very important.
So I don't know a lot of detail about this particular program, but I can tell you one of the HUD system performance measures, which we are held to account for, that helps us draw down that $30 million plus from HUD, is increasing income employment. So all of the providers within our network are charged with not only creating within their own house employment type programs such as Hilda described, but going outside to entities such as CareerSource to create new opportunities. I know at Chapman they have both inward and outward facing employment specialists. One employment specialist deals with the client, one employment specialist deals with the employer. They also have similar in-house program for trades training, security training, et cetera, in-house, and a social enterprise. So if I could understand the details, we could certainly look at that particular program.
But and now, you are the trust, you don't have a specific program like that it belongs to you. That is, I think it's a very important program. I think it's very important. You see, you can, and I'm suggesting that you start a program like that, or you partner with them, and then try to increase it, and not only for hotel and motel for the service sector, but also construction is very big in South Florida, and they are all the. Maintenance is also, try to give them a goal, you see, that if they go through those training, they will be able to find a job and get out of the street.
I'm happy to better understand that particular program and the details of
Okay.
it and how we
Mr.
might
Watson,
be
you
able
have
to
any
help.
questions?
Yeah, Mr. Chair. A couple things. I think that therein lies, hopefully, some of our solutions is for even the service providers to collaborate more, to help us understand what we need to do to help, to assist them. Because money spent in a different way to help the problem allows us not to have to spend it in another way. That's one. Two, I wanted to find out through Hilda's program, do you have someone in the field? For example, two things. Are you allowed to do data collection from unsheltered people?
So in terms of data collection from unsheltered people, the only ones that we would capture are any unsheltered homeless that are served in our day center. We operate the only day center in the county. So we have individuals that come in, as you know, to take a
And then you let 'em
shower
go out, right.
and, have a meal in the mail. So we capture all of that data, but, all of the homeless do not use our day center, obviously, although many of them come and get an RID.
So with regards to the commissioner's observation, if you will, so people who are unsheltered that are on downtown, 10th Street, 7th Avenue, you have no data on them?
Well,
We do.
yes.
Okay, all right,
We do.
okay.
We have it, if I could, Mr. Chair, we have that, Commissioner Watson, in our HMIS system. Our homeless management information system has much of that data. It will tell you how many times outreach and our various teams and programs have accessed and/or had folks that are still on the streets inside of our programs, all of the various times they've been there. We have all kinds of data on each of them.
So can you,
Not gonna say we have everyone, because if we haven't encountered somebody and inputted them, we may not have them, but the vast majority we do.
can you speak to the number of people in that population that might be receiving assistance from the federal government, be it veterans or any other sources of money other than what we might imagine? Or you don't have that sort of
I
information?
think we're certainly able to tell you those within the system that are veterans. And to that point for just a second, we're one of the communities, I'm going to say something that will offend some people outside of Florida, but we're one of the few communities that reached a legitimate end to veterans' homelessness. We reached a legitimate end to it. We were held to a different standard by the federal government, and we're particularly proud of that. But yes, we know we still have veterans that are out there because there'll always be some kind of circulation due to mental health, substance abuse, alcohol, et cetera, that we cannot force care on consistently. But yes, we have a lot of it. I don't know that we have all of what you've asked. Vicki, what did I miss that we do have on economic data on them?
Just the other thing to Commissioner Reyes' observation that might be helpful. If there were, because I've seen it as well, I've seen the relieving of yourself on the street. So if there were just people, ordinary people driving around in a car we sponsored, we'd see that, know that, and then identify that as someone that you all can immediately come get and deal with from a different perspective. Just that would be helpful, because now you're pulling people out and then give them some direct service immediately in order to help with the situation, as opposed to somebody calling 911 or what have you, and they having to come. That's a much more expensive phone
Yes.
call than it is just riding around. If you're just riding around, you'll see it, okay? And I think that's what's now bringing us to this point. What is it that we can do better with the small amount of dollars? You to rent a car on a person and pay them $15 an hour is still cheaper than calling one of these guys for an hour to do something different. That might be helpful to the situation.
So, Mr. Commissioner, if I may, your outreach teams do that. And in all fairness, the daily demand for shelter beds has historically exceeded capacity. The homeless facilities will report our bed availability by 8:30 in the morning. Pre-COVID in particular, pre-COVID, I shouldn't say that, pre-COVID, we would report our bed availability by maybe 8:30 in the morning. And in the entire system, there's five homeless facilities that provide emergency housing. Lotus House, Camillus, Chapman Rescue Mission, and Salvation Army. Those beds that we reported before COVID on an average daily basis, maybe, Sergio, 10 or 11 beds available for the entire period collectively. And those beds would be gone by 10 o'clock in the morning. So there is, now what we had available as a result, good, bad, or indifferent, of COVID, is that the Homeless Trust went out and rented out quarantine and isolation hotels, basically, or spaces. They're not hotels. So that right now there is greater capacity that if someone calls and says, I want to be served, they can be served. They can be taken to a quarantine and isolation hotel. And once they get cleared, with, that they're not positive for COVID, 2 negative tests, whatever, then they get sent to Constance, to me, to Chapman Rescue Mission, Salvation. So, it doesn't mean that there's super duper capacity, but there has been an increased capacity as a result of COVID because the Homeless Trust had to make available these locations so that people had a place to go before they could come to shelter, or if they were positive, where they could go and convalesce before they could be, whatever could happen with them next. I just want to emphasize, Commissioner, the outreach teams are out there, but the outreach teams are often, they're gonna convince a lot of people that might be service resistant, but capable of having a conversation. The ones that might be a working poor person who lives on the street, and by the way, sadly, we see them because they come to take a shower at Camillus House at 6:30 in the morning to go to work because they sleep on the street and they can't go to work, dirty. So they will come and line up at 6:30 in the morning, make it inside to take a shower to go to work, and yet they have to live on the street. That is the individual that can be helped with rapid rehousing. Because, maybe they don't want to go to shelter. There are some people that do not want to go to shelter for whatever reason, and that's fine. We can skip the shelter. We can move them from the street directly into housing through rapid rehousing. So we're looking at, Sergio and I spoke about doing a training for the outreach workers. I think it's Tuesday, on how to identify those people they engage with, like that guy that comes to take a shower at Camillus and goes to work, to how they can help us engage those folks, bring them to us so we can start the process to refer them to rapid rehousing. They don't have to wait for a shelter bed, and they may never want a shelter bed. So rather than waste our time and energy in trying to convince them, we could probably convince them, hey, if I can get you your own apartment, you have the resources and we can help you short term, is that something you'd be interested in? Yes, I would be interested. And then let's get the paperwork going, because there's a lot of paperwork. We can do the paperwork for them. We have someone in our day center whose job is to do that for the street homeless, and we're willing to put, have someone go out with the teams, the green shirts, to do that for people on the street. So, the police officers are a different kind of resource, because, again, our green shirts may not know that there's this person someplace, behind in an alley that isn't obvious to the outreach team, that no one else is called about, but needs assistance. There are extra eyes out on the street. Our police officers are asked to do a lot of stuff. We don't expect them to be social workers too. They're busy enough, but they certainly have the capacity to identify, and we know they have, the empathy to want to help people. That's why they're in public service. So we know for some officers, that's a frustrating issue as well, that they don't know what to do and how to help. So, providing the means to educate them on how they can help or connect the people to the resources, we'll do our job to convince the people to come in, us or the green shirts or the Lazarus team or whoever. So they still are part of the equation, but I agree that they shouldn't be carrying the load of being social workers and taking care of the problem. They got other issues they got to worry about.
Through the chair, I'd also
Thanks.
like to mention that the deferred item, which included rapid rehousing, had a more intensive level of case management built in, so that entities like Camillus are better equipped to work with someone directly from the street. There's it's a lot different dynamic in working with a client who is captive in your shelter versus working with someone who's on the street corner and you were trying to make an appointment, make sure they get the basic documentation so that they can move into housing, to help navigate housing with them. What if they're not there? What if they don't make their appointment? It's very cumbersome,
Just-
but we need to get better at it.
Just for my own information, when you refer to rapid housing, who provides that? The trust?
We fund it.
So
The trust funds it.
rapid rehousing
And you
is,
fund it through that ESG.
Okay, that's what I would like to, that's what I'd like to see. I'd like to see all of you guys working together.
oh, yes, we do.
Okay.
So the referrals to rapid rehousing have to come through the homeless trust, because that's how the system works in Miami-Dade. That's what HUD wants, for us to use their money. But again, that $5 million that was on your agenda 2 weeks ago, the item that was deferred, of that $5 million, a very big chunk of that is rapid rehousing. A portion of it is for homeless prevention, again, for the very poor that are about to become homeless, part of the 7,400 on that eviction list, that when the moratorium goes away are probably going to get evicted, or likely get evicted. But a big chunk of that $5 million is exactly for rapid rehousing. So
Okay.
those people on the street that are saying, I don't want to go to shelter, very frustrating for Sergio, super frustrating for police, I'm sure, and equally as frustrating for our residents and our businesses and you. Those are the ones that we can use the rapid rehousing dollars to move from the street directly into housing, or the ones who are in shelter, move them into housing and free up a shelter bed for the street homeless who is willing to go into a shelter.
But that money will go to rapidly housing, which is financed and right now by the trust.
The trust
Through
has
the
their own
trust.
allocation. You, the city, received.
No. I mean, if we don't provide those funds, who's going to provide those funds for rapidly housing?
Well, I mean, that means for us to have at our disposal, we would have to use whatever other rapid rehousing funds we
Okay,
have.
what I want to drive at is that I don't want to make different services mutually exclusive,
Oh, no.
okay? What I want to see is, I personally want to see that we provide those services, but at the same time that we provide the services that we were talking, and hire the necessary personnel to be out on the streets.
Oh, yeah. It complements
You
commission.
see?
Yeah.
Yes.
That's what I like to see. I like to see a comprehensive plan where everybody is working together and the funds are using effectively.
Mr. Chair, if I may, we just, the Homeless Trust has just coordinated a call yesterday specifically on how to address the street homeless situation focused on the city of Miami. And the input that they received from the service providers, from the outreach teams, from everyone was, we really need some specialized teams focused on substance abuse on the street.
Absolutely,
Subsequent to that,
absolutely, but here who comes first, the chicken or the egg? I mean, we need the funds. Who has the funds? You have the funds.
yes, and they're
Okay.
willing, and they're willing to
You
use
have
them.
the funds.
We are
And then
yes.
We have limited resources, as you well know. We have limited resources. We use our resources, we want to use our resources as effective as we can. But you have all of the resources, and I want to know that I'm not criticizing you or anything. What I want to see is that we become more effective. We become more specialized, and we try by all means to work together and achieve what everybody would like to see. Less people on the street, more people reintegrated into society, see? And additional help to those people that they don't want to be out of the streets. You see, try to guide them in a way that they can survive, okay? That is my point.
So I just want to also put things into perspective. 15,000 people come through this continuum every year. We're not serving 15,000 all at one time, but 15,000 people come through the continuum at least in a year.
Okay.
On any given day, we're serving upwards of 8,000 people. So the people you don't see who aren't in the shelters are in subsidized housing programs. Much of the funding we receive from HUD, similar to the ESG funding, is really laser focused on housing. And I don't have to tell you what's happened to the food and beverage tax.
Yes.
As a result of the pandemic. Our January numbers
Yes, I
came
know.
in yesterday. We're down 39% year over year.
Yes, I do understand that now we're going to get a hit.
Yes.
And the hit, the trust is going to feel the hit too. Everybody's going to feel the hit.
Yes.
But that doesn't preclude us from, establishing a strategy that you guys work together and try to at least try to get some people out of the street and help those people that are in the street. That's the only thing we want. And that's the way I feel, Mr. Watson.
No, I think, Mr. Chair, you're correct. I think and if anybody else referred to the error we made on the $5.1 million, you can't speak. I think, Mr. Chair, we really didn't fully know what that money was for.
That's right.
And whether not being briefed or privately or publicly, we didn't get a chance to fully flush it and understand the nexus between additional dollars for a service that we don't provide, and should not now try to gear up to do that, and staff should bring that back so that we can move those funds so that they can now do what they do. I think there is the biggest thing. Sometimes it's not even legislation. Sometimes just making sure the parties do come together and talk about what's going on so that we can help do that. I have to tell you, I asked about the data collection because clearly, look, an illegality is illegality, whether you're homeless or not. You're not being arrested for homelessness, you're being arrested for illegality. And so I've heard this story about people getting checks and then using their checks for something other than what they should be using for. And so that also exists. And so we're just trying to make sure we get the best information. I think someone from here from the Lotus House?
Yes.
So I don't have,
Yes,
we can hear from another
let's
person
hear
as well.
from Lotus House, and welcome Commissioner Carollo, that also he is very interested in this problem.
I am, and this is one of the main issues that's affecting our city. I apologize to my colleagues and everyone that's here, but I wasn't here from the beginning. But I've had a family medical emergency that I've had to have dealt with. I don't know how long I'll be able to stay, because as you can see, I haven't slept last night, so I still have to find my way to the shower and get ready for the rest that I got this afternoon. So, having said that, if Commissioner Watson, I guess you're chairing this since you requested this meeting. I only want to take a few minutes to make a statement. I think every other member of this commission, employee of this city, resident of Miami, want to deal in a humane, civilized American way, if I may use the expression, because that's how America is. With anyone that's falling in hard times or have drug, alcohol addictions, or mental problems. But having said that, I look back, and I know a lot of time has passed since I was mayor, but when I was mayor, we had the handcuffs on us that have been taken away. We had Pottinger, and we dealt with it accordingly, respectful, and we didn't have this homeless problem that I see that we have today that has been created from past administration and it's reached the point that it's reached today. That's why the first thing, or one of the first things that I did when I came back on the homeless issue was I suggested to this commission and presented a resolution that was approved unanimously that we would go back to the courts and do away with Pottinger. We won at the trial level. It was appealed, and we won the appeal. And I see that nothing has changed. This Sunday, I don't know how many of you work Sunday, but I work Sunday. I was in Bayfront Park. I was in Foray Park on matters of the trust and the city. And there were dozens and dozens of homeless in both parks. I brought my executive director, Jose Solano, so he could hear some of this, because I wanted someone besides myself to hear it. And we approached first two individuals, and I stated to them, look, it's going to be getting cold the next few days, very cold. Would you like to have a shelter that you could be protected from the elements, have a bed, have food? Right away, the answer was no way. We want to be able to do what we want. One of them even kind of joked about they can't do their drugs inside these places. I asked them where they were from. One told me he was from my old stomping ground where I grew up as a kid, Chicago, Illinois. The other one, Winston-Salem, North Carolina. We went over to some additional people, individuals. The next one, New York. Following one from San Francisco, California. And the fifth one that I approached from New York also. I figured, what's the use? I'm not gonna, ask anybody else where they're from. And I was offering them all shelter because we knew it was going to be getting cold. Nobody wanted it. In fact, they were almost insulted that it was being offered. So having said that, if we are going to be a city that all the entities that we give millions of dollars to handle the situation, that our employees are not going to do anything that we could do under the laws. And everything's going to be the same. And the only people that are going to have rights are those that are so-called homeless, that want to be homeless in most cases, or in the situation they're in because of the drug problem that they had that then led to mental problems and then led them to wanting to be in the streets. If we're going to be in a situation that these kind of individuals that are being sent to us, for the most part, have more rights than our residents, that the ones that don't have rights are our residents, that in many occasions, and I see it in my district and others, they put tents, sofas, you name it, where no one can walk through the sidewalk, where the green shirts, nor anyone else is cleaning those streets. They're like that. And the sanitation and health problems that we're having are major. Safety is also a problem. And if you don't believe me, just stand in some of these places and see the fear in the eyes of our residents that are the ones that contribute so that all of you can have a salary and pay most of the funding that we give out. So if we're going to be in this situation, that the only ones that don't matter are our residents that pay taxes, that work hard, the only thing they want is to give their families a better place to live in, then I am going to start placing motions. I don't know if I'll have any support or not, but I'm going to be placing motions to start defunding programs, to start defunding individuals that work for us. No one's going to tell me, involved in any of this homeless stuff, that they work harder than any of us up here, certainly not harder than myself. But I also see some of the salaries that are being made way, way above anything that any of us make up here. And when I see people that have that kind of salary and that responsibility, then, and they're not taking this serious, then I have a major problem with it. So, you could come up with whatever plan you like. You could play the fiddle to us all you want. But if in the next 30 days to 45 days, we're not seeing results out in the streets. Seeing a difference being made with the monies we're spending out in the streets. I'm going to be starting to make motions to defund. And with the monies that we're defunding, they want to live free, that they could do what they want, then we got places that they're not going to bother other residents. One of those places is Virginia Key, that we have hundreds of acres that are available there. And we'll make that Camp Barney if we have to. And those who want to give free tents, they want to give food, they want to sing Kumbaya, they'll be welcome. But they're not going to be blocking sidewalks where our residents can't walk through them and have to go through the streets. They're not going to be urinating in public or having sex in public. They're not going to be committing crimes and stealing from many of our residents' homes and breaking in, like is happening. And it'll be in an area where they'll be happy and we protect our residents. And I don't care what anybody says about me in this, because I have had it. I don't drive the fancy Maserati or the Mercedes or anything else out of the salaries that are being paid for the homeless program so we could have top executives. In January 11th meeting, Mr. Clerk, if I'm wrong, please, you correct it in the record right now. This is a statement that I was just given that I made. For the meeting, we're talking about the next meeting after January 11th, I am requesting the total line item with anything having to do with homeless, beginning with the last 5 years, in the new budget and how much we have given to Camilla's House, the trust, and everyone else we have given dollars to, including salaries of the green shirts, Mr. Vickers, and everyone in that department, including benefits. That was January 11th. We have a resolution that was passed by this commission several years ago that I presented also, that within 5 working days that the commissioner makes a request, we're supposed to have the information. We're February now, and I still haven't received the information. And this is the whole problem that we have in this city. I've come back to a culture that it was not the one that I left when I was mayor. A culture that people don't want to work, they want to do what they want, there's no supervision, it's a free-for-all, and they get away with it. And I'm not going to put up with it anymore. I'm going to start using that word that's been used so often in the past month, defunding. But I'm going to defund where it needs to be defunded. And if we're spending millions to solve a problem, and nothing is happening with the problem, then why keep throwing money at it? Obviously, money is not the problem with them. The shelter beds that we pay for, we have dozens and dozens and dozens that are available all the time. But I will say this to you, the county, unincorporated areas in other cities don't have the problem that we do. Coral Gables doesn't have it. Key Biscayne doesn't have it. Pinecrest doesn't have it. Aventura doesn't have it. A lot of nice unincorporated areas in Kendall and other parts don't have it. Why is the problem being sent all to the city of Miami? And it's not fair to our residents anymore. Many people don't give a darn about it. I certainly do. And I want our residents to know that it's not because of the people sitting up here that this is not being resolved. And I'm talking about resolving this in a humane way, where everybody can be given a bed, as we talked about. If they don't want a bed, fine, we'll give them a tent. But you have no right, if you're given what you need to live in a dignified way, to throw yourself down anywhere you want to, block streets, piss in the street, have sex where, the tent is all open up, be harassing women, and worse. So, you guys figure it out, but, I don't even want to hear it anymore. I want to see the action. And if I don't see changes in the streets, I'm going to try to implement them up here, and it's going to be starting with defunding everybody. So some of you might have to get used to driving Volkswagens or Chevys. But you know what? Our residents can't pay this luxury type of tax any longer and get the lack of results that we've been getting.
Thank you, Commissioner. Now let's hear from Lotus House, and I want to make a comment on what you have said. I know that all of us, we are very upset of certain liberties that homeless takes that a regular resident cannot. And that was a question that I asked the city attorney. What is the authority of the police department now that Pottinger is not in effect, and how can we can avoid all that? And that's something that we have to address. Now let's hear to Lotus House.
Thank you very much. My name is Constance Collins. I'm the executive director of the Lotus House Women's Shelter. I want, to the commissioner's point, to make it clear that I have worked for the past 15 years as a full-time volunteer in that capacity. We are the largest women's shelter in the state of Florida. We shelter over 500 women and children on a nightly basis. During the pandemic, we sheltered a record number, 1,354 women and children. In that number, 683 children. 80% of those we shelter exit outside the shelter system, historically from Lotus House. We recognize that violence is the lead cause of homelessness for women and children. We have a deeply therapeutic supportive service with over 23 counselors on staff who provide a full range of evidence-based therapies and assessments for women and children who have experienced violence and trauma. The Homeless Trust funds slightly less than half of the cost of a bed at Lotus House. They're funding approximately 405 of our 510 plus beds. The city funds approximately 8 to 10 beds at our shelter on an annual basis. Health and Human Services funds approximately 20 beds at the federal level for homeless youth, both single unaccompanied youth and parenting youth. That means that we provide in-kind services, value of approximately $3.7 million a year to the Homeless Trust and the larger continuum. Over 75 of our beds are unfunded completely, other than through donations that we garner from our community, that's another $1.2 million in value to the overall continuum, over $5 million. We raise or find alternative sources for in-kind services for women and children experiencing homelessness in our community. We need more help. Pre-pandemic, it cost approximately $45 a night to shelter high special needs women and children. It costs us about $50 a night now. We have had to implement a whole public health team. We work very closely with Jesse Trice to embed as many medical services as possible within the shelter, regular weekly COVID testing. We have come through this pandemic not once lowering our occupancy. We're fortunate because we have a facility that is state-of-the-art, again, entirely privately funded, and yet the cost of operating is significantly higher than it's ever been for reasons relating to PPE and sanitizing and needing additional staff and additional guest supervision. These are the most challenging times I have ever experienced in the history of this shelter. Every single time a bed opens, it can be filled within 24 hours. If you have additional resources, I pray, as I do every year before this commission, that you dedicate some of those resources to our shelter because we are in need. And we cannot allow women and children to be living on the streets. This is a matter of keeping families together. It's a matter of ensuring that children don't go into the foster system needlessly because their mothers are unable to provide a roof over their head, or they need access to food or medical care, or any number of other things that we provide. So we ask for your help if you have additional resources, because we need it. The second thing is we would encourage additional resources for substance abuse counseling and treatment across the system. Within our team, we have a number of counselors who are certified addictions professionals. But we recognize that substance abuse is a function of untreated mental illness. And accessing mental health care within our overall system is extremely challenging at times, particularly substance abuse beds for women with children. Approximately 30% of Lotus House adults have some history of substance abuse. But we also know that it's incredibly important to provide recovery supports for our women so that they can remain sober, clean, stable, and build the foundation for a new life for themselves and their children. So I cannot emphasize the importance of having those kinds of resources at every shelter. I would also say, to state the obvious, we have an enormous need in our community for affordable housing for extremely low-income individuals. We need to eliminate zoning barriers. We need to eliminate other kinds of barriers to the construction of that housing, and we need to fuel that housing because everyone deserves a home. It's the fundamental basis of liberty and prosperity and quality of life for any of us. All you have to do is go by the encampments and you know how critical it is for each and every person in our community to have a home. So I would encourage that. And lastly, I would add that the beach municipalities are not contributing funds anywhere near their share to the Miami-Dade County Homeless Trust and the domestic violence system. Miami Beach, Surfside, and Bell Harbor do not contribute to the 1 penny food and beverage tax. As an aside, I also serve on the Domestic Violence Oversight Board. I chaired the Gaps and Needs Work Group. Miami Beach, historically, over the past decade, has always been in the top 5 in numbers of domestic violence incidents reported. And yet their contribution to the domestic violence system and shelters like ourselves pales in comparison to their responsibility. If we're going to look at systemic issues across our community, then we need every single partner and stakeholder at the table, and they need to contribute. Lotus House stands at the intersection of domestic violence and homelessness because we serve exclusively women and children. We need our community's support, and we need our entire community's support contributing to those resources.
Okay.
Happy to take questions.
Well, I'll make a statement. Lotus House is very different in the people that you have going to you than the problem that we have in our streets. I doubt very much if the bulk of the women that you treat with the children, you see them in the encampments with the problems that we're having. They're not there. I drive through the city of Miami, and I don't see that type of clientele out in the streets that you bring. You serve a type of clientele in an area that is very, very much needed in our community. But it's different than the overall topic that we're concentrating on today. And you touched upon a couple of areas that is where we need to put more funding in. But the city of Miami can't carry that in its shoulders alone. And that's in mental health and substance abuse. Now, they don't necessarily go hand in hand, but many times they do. And the substance abuse is what's led to a lot of the mental health problems that we have in our streets. You know, the war on drugs, it wasn't that our government was fighting drugs all that strongly. The war on drugs was the war that they were sending to us, that we're seeing the results of it across cities, across our country today, of people that are burned out from all the drugs that they've taken. And that's why they're in the streets. But I will tell you what a friend of mine for years has told me. He, sadly, for a time in his life, got hooked with drugs. And he told me that you have want to get out of it. If you don't want to, no matter how many different programs you go through, it's not going to have any effect on you. And he talked to me about another friend of ours that's a major socialite in town, one of the richest families in Florida. And this individual has spent her whole adult life going from one very expensive substance abuse, whatever you call these places, resorts on that level. And she's still hooked into it because she doesn't want to stop. That's the problem. And this is what we have to face in Miami, that a lot of the people that we have in the streets, the one we're talking about, not the ones that you treat. And I agree, you need more help for the work that you're doing. But the ones in the streets, they, for the most part, have come from other places. They don't want help. They don't want shelters. They want to keep the life that they're doing because they have gotten used to a Miami that they don't have to worry about law enforcement saying anything to them. They don't have to worry about anyone. They could do as they please. Now, I hear from some of our police officers, well, we have to arrest them. They're out the next day. Yeah, but you know what? You take people out from the streets doing the things that they should not be doing enough times, and they'll get the idea soon enough that it's not like it used to be, and that they better move on, either follow the established rules, shelters, etc., or move on to another city that's more friendly. And this is what one of these guys that I was speaking to on Sunday told me. He had come after he left Chicago. He went to Key West, I think he said. And I don't know what they did there, but he didn't feel welcome. So he came to Miami. They were so open arms. And this is where he thinks he could just throw himself down anywhere he wants to. And we're going to take care of him. And I'm going to tell you, with this frame of mind, this city is in for some major, major problems in the very near future. Because we're going to be getting more people coming in, and if we don't know what to do with the situation, it's going to overwhelm us. And the minute that we start lifting from the state level, the laws that people that haven't paid rent that can be put out in the streets, we're going to be seeing all kinds of new problems. Because this COVID has hit everyone real hard economically. And, you know, I apologize, Commissioner Watson, Commissioner Reyes, but I'm going to have to run now.
Let me,
Okay, we have,
I'm sorry, go, Mr. Chair.
yes, we have another person that wants to speak. Commissioner Carollo, thank you for your contribution and a point well taken. And we have spoken, we have talked about everything and how to.
Yeah, let me
Try
just,
to do something.
let-
And I know that you have a previous engagement.
Yeah, I do.
Just go right ahead and
Yeah.
we hold the fort for you.
I don't know if I know this gentleman with the mask, you know.
You don't recognize me with the mask?
Okay, you live in Biscayne?
Yes, I do.
Okay, then I
How are
know-
you, Commissioner?
Thank you, good seeing
morning,
you.
Commissioner.
let me just say.
Thank you for
before-
allowing me to
hold on-
speak.
Hold on one second. Hold on one second.
Yep.
Before Commissioner Carollo leaves, because he did have a family emergency this morning, two things to your point, which is why this was, I think, at this point, good. Everybody could probably halfway agree in some respect. I think we came to some sort of moderate plan to bring forth as relates to the evictions. We hashed that out pretty good. We know that it's coming. And so something's going to come forth, which includes more collaboration and almost $100 million collectively in eviction funds. And we're going to try to identify those people are here, City of Miami residents, and how they're affected by that uplifting of the eviction moratorium, and funds that are available to assist them, and be aggressive about doing that, because what it does is it stops them, and it also, we came to some sort of conclusion on how the monies and the issue that we didn't fully flush out, rapid housing assistance that allows people on the street to be moved to housing, and frees up capacity to put unsheltered folk in those places where they moved off. Now, we will find out once you leave what's our ability to control people coming from other places, because that then is a concern, and continue to move on with the unsheltered issue and what effect that has.
Yeah, but-
Hopefully, very shortly, you will get your answer from staff on the question you asked on January 11th. I hope staff will not take too much longer beyond the 5 days and get you an answer so that we all can review that information as we continue to make decisions or better decisions on this issue. So I just wanted to let you know.
Thank you, Commissioner Watson, and let me just say this again. What I'm seeing, the problem is not a lack of shelter beds. The problem is that we have an overabundance of shelter beds, and people that are out there, so-called homeless, don't want to use them. They want to do whatever they please out in the streets because they feel that they own the joint. They're the ones that have all the rights, and residents like this that live across from Bayfront Park can't even go out and enjoy a city park, the Central Park, not just of the city of Miami, but of whole Miami-Dade County, because you got dozens and everywhere. You know, he could tell you stories better than I can, because he lives there.
If you will stay for 5 minutes, I'll be here for 5 minutes and leave. I agree with you in a lot of what
I'll
you
give
just
you
stated
two,
now.
because I really have to rush out.
I will. I'll be in 5 minutes. Number one, let me just state, I'm looking for funding. I'm not looking for a job.
3 minutes. 3 minutes.
3 minutes?
That's right. No 5.
Okay,
I'm going to keep track.
absolutely. Concerning the camping of the homeless living in tents and campgrounds, the city of Miami Beach has a no camping ordinance. If we could have that ordinance here in the city of Miami, then the police can go ahead and enforce that ordinance. It is key for us to be able to allow the police to be able to do that.
But we're Barney land.
You what?
We're Barney land. Remember Barney? We're Barney land. We can't have that. And this is the problem, that nobody wants to really go out there and work from one spectrum to the other. And I am just amazed that after we have had several very strong, heated meetings on this issue of homelessness, that the people that work for us, it goes in one ear, out the other, and everything's the same. We need, if people are blocking sidewalks and so on, they can't do that. Wherever people are lying constantly, we need to clean those areas at least 3 times a week, but at the very least twice a week if we don't have enough personnel. It's not being done. I mean, my God, where are the rights to the average common resident of Miami?
I agree.
Who's representing them? Well, I thought we were up here, but we don't have the ability under the charter to do what needs to be done. I guarantee all of you that if I had the authority under the law, you would see this problem resolved real quick.
Okay.
And anybody that wants to challenge us, we can take it all the way to the U.S. Supreme Court, and I know how it's going to end up there. But
You asked about Key West. I went to Key West a couple of years ago. And the only homeless that were there were like 3 people, and they were only allowed in the vicinity of 1 parking space next to the garbage dump. That was the only place they were allowed to panhandle. If they left that, then they will be liable for arrest. So this, obviously Key West and other cities have made laws to help not only the homeless themselves, but also the community. In my 19 years of working with the homeless, I placed them also in 3 categories. Those that want help, and I'm so happy we have organizations here that are doing a great job to help those people.
But those that want help, like you're saying, they go to Lotus House, and they get help there. That's why, I don't mind going above and beyond with Lotus House. I'm having a great problem in giving the kind of monies that we're giving out to other organizations that I see nothing is happening with our money. Same thing.
Yeah, I agree. Second, those which will not accept help. They're homeless by choice. That is their lifestyle. Using Ms. Millet's analogy, what if they don't want anything which is in the menu? You offer them permanent housing, they say no. You offer them shelter, they say no. You offer them a ticket back home to be united with family, they say no. So they don't want help, that is their lifestyle. Why do we continue to allow that where their rights are better than the rest of us, our rights? We're hurting them by allowing them to continue to live in the streets. We should actually try to persuade them to accept the help which is being offered by so many organizations, by the cities, where our tax money is being spent with the hope that they receive the help. Why don't we go ahead and pass laws? Maybe we should pass a law where homeless by choice is illegal, where the person is asked numerous times to accept help, all kinds of help, and if the person doesn't want it, then the person will not be allowed to live in the streets. So, as I stated, I wanted to be brief, and I am being brief.
Thank you.
Thank you so much for your time.
Thank you.
Thank you very much.
Before I go, Commissioner, if I could just say that while some of what I said might sound harsh and to some of the organizations that are here, I haven't forgotten that at the end of the day, none of you are law enforcement organizations. And no matter how much you want to get someone that's out there that wants to be homeless into a shelter, and if they don't want to, there's nothing you could do. And that's where our law enforcement comes in. And there we also have a problem, because we need the commanders of every district to enforce our laws, to work with you. If they don't want to, for them to know that, you got another choice. And that is, you could leave Dodge, or you're going to go to the county jail to, maybe it's a Baker Act, maybe in another fashion, and you get enough of that. Legal detainments, where we're doing it to protect the safety of our citizens. And you're going to see that the word's going to get around that, hey, that Miami is not the place it used to be anymore. Let's go to somewhere else. And, I don't care if I take the beating of this from certain groups or individuals, as long as we resolve the problems for our residents in Miami.
Commissioner, yeah, I hear you. I feel very much like you. I expressed myself. But I have to understand, and everybody have to understand, that our police department is shell-shocked because of Pottinger. Now, we got rid of Pottinger, and I ask that the city attorney provide the the police department with the do's and don'ts, what it is permitted under the law, that the police department what can they do, you see, and how can they avoid people doing illegal acts in the street of Miami, and what are the consequences. And our police force should be trained.
Absolutely.
That when they see or they know of some violations, and I told the chief, and the chief got very tested. I know my police officers, they are trained. No, I don't believe that, because they've been told for many, many years, don't touch the homeless. Don't touch it. Don't get near them. You see, now they don't know how to act. We have to retrain them. We have to retrain them, and in order to do that, we need specifically from our law department what are the rights of the homeless and what are the rights of the police. Okay? How can we protect the right of the residents without violating the rights of the homeless?
Commissioner,
And I know you have to leave, and
yeah,
so.
all that I would like from our law department is to send me what we can do
And what we cannot.
to enforce our laws, what we can do to enforce our laws and protect our residents.
Okay.
I've heard enough of what we can do, so now I'm asking what we can do. It's a heck of a lot that we can do.
Yes, sir. Okay.
Thank you. I
Now,
apologize.
I think that we have heard about you, Mr. Watson. You think we have heard, and I wanna take the opportunity again and request that all the agencies work together, that the money from the trust be spent in, because we know that there are people that they want to be homeless. We should find out why do they want to be homeless. And hey, listen, this is not a new thing. You see, after the Great Depression, we still had hobos going all over. And in Chicago, when I lived in Chicago, there was even a street called Adams Street. There were people that like to live there. They want to live on the streets. That's a fact. Some people, they don't like responsibility and all of that, but they cannot infringe on the rights of other people. So what we have to do, in my opinion, what we have to do is the Homeless Trust and all the institutions, we have to work together towards the same goal. And the funds that we have to be spread, you see, efficiently in programs like the training programs. You have training programs, let's enhance them, let's increase them. Lotus House needs help because they provide an excellent and a very needed service. You see, particularly for females. You see, I'm the only boy, 4 girls, you know, and I would really hate to see one of my sisters standing for abuse because she doesn't have a place to go. You see, and that is terrible. And there are many females that they are enduring abuse because they don't know, they don't have a place to go. And we have to protect them as much as we can. And I really, I've been helping Lotus House as much as I can, and I'm going to continue helping you guys because it is a much needed program. And we have to tell all those ladies and young mothers, you're not alone. You're not alone. You don't have to take that. Okay? So please, let's work together. Let's work together. And you from the trust, let's look into all the programs and see how you can join forces and make this a better society. Okay, having said that, I pass it to my colleague and friend, Jeff Watson. Sir?
Mr. Chair, I think we've probably heard as much input from service providers as we can. If we can now hear from the administration on the issues of cost to us on this issue. One, what other kind of best practices are being, that they are aware of. I mean, clearly, look, if Miami Beach not pulling this weight, then Dan Gelb ought to know about it, because he always stand up and saying something I think is halfway cocked, but that's his own deal. But if he's not pulling his weight, then I'll send him a letter or give him a phone call and tell him to pull it. But there's others who are doing stuff around the country, and we should try to figure out, what sort of successes might exist as relates to the very specific nature of the physicality and visibility that we see, and how can we better address that. So the administration, I guess, can start out with either Mr. Vickers, who's leading that, and then hear from our police department. We can.
Okay. Well, having said that, I have to go. I have to leave also. And thank you, Mr. Watson, for this, giving us this opportunity. I really hope that something productive comes out of it. And we are going to be looking at it, okay? Thank you very much. You had something to say, sir? Be very
Chairman-
brief, because I have to
Chairman,
leave.
Chairman, I simply want to say thank you. I think this has been very productive from our end, as we hope it has been for yours. And each of you, I would urge, Commissioner, if you see something you're not happy with, I know you can call the manager, you can call Mr. Vickers, but we hope that we're all comfortable enough with each other at this point that you'll pick up the phone and call me directly.
Absolutely.
If you're not happy.
Ron, I'll be calling you. If anything that I see or something, I'll be calling you, okay? Thank you, sir.
I would appreciate
Yes,
it, just know I'm here.
Yes, sir.
Thank you, Mr.
Your
Commissioner.
name, please.
My name is Reuben Young. I'm here representing my friend today, Laverne Spicer. She's with Curly House. I've been there since 9:30 because she wants to lend her voice to this issue. Curly House is a food bank within the Liberty City area. Oftentimes when you find yourself homeless, you still have to eat. A lot of the homeless people come to her facility, and with the limited amount of resources that she has, she does a lot of things to help the community, seniors, those at home, and give opportunity for people with work, unlimited resources. So she want to lend her voice to this conversation. This is a conversation that she's had direct contact with because she's in the community. She's not in the ivory tower anywhere. She's out there literally helping our homeless as well as referring people who are homeless through the various agencies. And I get a chance to finally meet Ms. Millette. When I work with Representative Bush, I used to do a lot of work with her. So we want to be a part of that conversation. So when there's a need for assistance, when people need resources or need food security, Curly House would like to be a part of that conversation in the aid of our homeless as well. So I want to thank you for this opportunity, and we're so proud to have the appointment of Commissioner Watson.
So are we.
He's one of the best. He's one of the best
So are
minds. He's one of the best minds in Curry House. Looking for the opportunity to also sit down with him and continue that relationship as they've had with Commissioner Hardman and Michelle Smith-Jones. Thank you very much.
Thank you. And sir, well, having said that, I think that we shall adjourn this meeting. Thank you very much, all of you, for being here. And God bless you. Drive carefully. And let's keep on working together. This meeting is adjourned.
Commissioner Reyes? I'm sorry, Commissioner Watson, were you going to have the administration present, or were you adjourning?
I think
I think Commissioner Reyes has to go.
Okay.
But I don't want to now not get what the administration has prepared. So what I would encourage all to do, even for their time, is to submit to us, each one of us, that information that you have prepared so that we can review it and then come back and I called this, I'll work with the administration in order to ensure that we have some sort of comprehensive response to this and do what's necessary so that it can be we can have a better response and do a better job of this issue. So if that's okay with them, then Commissioner Reyes has to go. I appreciate it.
I would like, because I received this morning,
Okay.
and I haven't been briefed on what I would like is for the administration, when they're going to, before they do a presentation to the full commission, schedule a briefing with every single commissioner.
Yes, sir, we will do.
Is that right?
Yes, we will schedule the.
Okay, thank you very much.
Thank you, everyone.
Thank you, and God bless you all.